Hello everybody, Dr. Carlo Oger, board certified emergency physician with DrER.tv and of course this channel, EDXit Video Pro, targeted more at the professionals, the healthcare professionals or pre-healthcare professionals that want to learn about medicine. In this series, we're going to do radiographs and we're doing x-rays of the chest to start with. And this is both the AP, anterior posterior chest view, and the lateral view of the chest. And we're going to try to see if we can recognize the different structures. As we described in the previous video, main structures, clavicle, trachea, ribs, shoulder, heart, diaphragm, and of course the chest and everything else, okay? Let's erase that. And let's see. So the first thing, the cardiac width, or this X over here, it's normally less than half of the width of the thorax. The half of the width. So you got this long view, and the heart should be about half of that. That's called the cardiothoracic ratio. And if there's increased, then you think that the patient has cardiomegaly or heart megaly enlargement, cardiac enlargement. The left side of the heart border is formed by the left ventricle, this arrow right here. And the right side of the heart border is actually the right atrium, all right? So it's not the ventricle, what you're seeing there. So cardiothoracic ratio and left ventricle and right atrium. Now let's talk about the interlobal fissures. On a PA view, you can see this white line over here, and that indicates the minor horizontal fissure. And then on the lateral view, on the side view, you can see the major, which is the oblique line right here, and the minor, the one we showed over here, the fissures. So we're also seeing the aorta, and on the PA view, which is this one here on the left-hand side, you can see the aortic knob, which is small. And on the lateral view, you're actually seeing the arch, the curvature of that aorta. Now, this is a normal patient, so eventually the aorta disappears. You don't see it down here. So you get the aortic knob, the aortic arch on the lateral view. We talk about major and minor fissures on the right side lateral x-ray. Also on the lateral view, you got the right ribs, which are further from the diaphragm cascade, so therefore they look magnified. Then you see the right down here, and then the left ribs over here, kind of like going like that, the left, and the right is further out. And that's just because it's further out, so it makes it look like they're bigger when they're really not, because it's a PA film, all right? So let's go to the next picture over here. Now, there's a lot of detail right here, and I can tell you, if you know this stuff, you're going to know more than most physicians in practice, because over time, we forget, and we don't sit down to study, and we don't review these things. So this is what you're going to see on the x-ray. And there's a lot of arrows, but let's talk about the main ones. Trachea is easy, but then the trachea divides, right mainstem, left mainstem bronchus. So that's there, and those are easy to identify. That's why I started with those. What else do we got? You can actually see the left subclavian artery, and all you can see is this little, let me make that a little smaller. That right there. The right paratracheal stripe, that just means the stripe is a line next to the trachea, so right there, and it ends in the arch of the azygos. So if you're ever looking at x-ray with an attending and say, oh yeah, that's the azygos vein, they're going to be impressed. I can tell you, they're going to be impressed. And then the azygos, then go back here, and you can see the azygos esophageal recess. The left paraspinal line, so it just means that you can see the spine, and it's left to para next to the spine. You got that aortic knob we talked about before and the aorta, and you can see the descending aorta in this patient. All right. And then you got this here, which is the right pulmonary artery and the left pulmonary artery. And then this thing here called the aortico pulmonary window. So where the aorta and pulmonary artery meet, that little meet right there is the aortic pulmonary window. And to make it easier, look at this diagram. So if you couldn't tell from my identifying the little things, then you can review this picture right here. Again, things I would definitely know that this is the azygos stripe and the arch of the azygos vein. That would be pretty impressive. That the aorta you can see all the way down. That you can see the right and left pulmonary arteries. And that the aorticopulmonary window is this right here, that junction. And that's, again, the evaluation of a normal chest radiograph and what are the structures involved. And again, if you spend a little bit of time just right now, pause this video and memorize these little structures, man, you're going to impress an attending one day, and you're going to just know your anatomy. So let me know how you like in this video series. I plan on making them hopefully every week, minimum one. I'm going to try to pull up and do a few per week. And we'll move into pathology very soon. I just had a patient who I intubated, and seems pretty interesting x-ray. So I'll be bringing that in the next video. Take care, guys. Bye-bye.